Hi, I'm Louise from Adore Your Pelvic Floor, and I'm joined here with the beautiful Louise Ross. We are having a nice chit chat together because we're going to be discussing the importance of smear test and also cervical cancer. It is Cervical Cancer Prevention Week, and so it's very apt at this moment in time. In fact, I know that Louise is really busy, aren't you, Louise, with everybody wanting you this week to do this kind of video. But it is really important, and Louise is really generous with her time to help raise awareness, and that is exactly what we want to do at Adore Your Pelvic Floor. So Louise, many thanks. Just a quick brief history of you. You've had 2 children, and then you went for your standard smear. And it came back saying that you needed another one, and you weren't too worried. You had your second smear. You did then end up needing to have surgery and some treatment. And during that period, it must have been really worrying because you had a very unusual cervical cancer as well, didn't you?
Yeah, so I was diagnosed with a really rare cancer called large cell neuroendocrine cancer, which is probably out of 200 people in the world that would be like diagnosed per year. So it's very rare, you know, compared to like your common cancers. So yeah, and the survival rate for that particular cancer is very low as well. So it was a very worrying time. But yeah, that's the type of cancer that I was diagnosed with. So yeah.
Okay, honey. So after your treatment, you then also were in that funny place. Because I think that when you are going through any kind of illness that is very consuming because of the necessity of it being consuming, of getting yourself looked after, of survival, there's that weird stage afterwards of now what do I do? And you had that, didn't you?
Yeah, it's really common for people with any type of cancer at all to have that kind of feeling, because when you're in treatment, regardless of the treatment, whether it's surgery, chemotherapy, radiotherapy, immunotherapy, your kind of end goal is just the end of the treatment. It's not, you know, you're not really thinking about anything else. You're just like, I'm going to beat this, I'm going to beat this, I'm going to beat this. But when you get to the end and you've got that positive affirmation at the end saying, you know, you're clear, you know, it's just you lose the person that you are, and you're like, well, what do I do now? I've been so focused on this particular outcome. I've got the outcome, which is brilliant, but what do I do now? So yeah, it's very it puts you back in your place. Certainly does.
That is I love that line, puts you back in your place. I love that. I can imagine. And I know that with the pelvic floor issues, you know, we talk about in Adore Your Pelvic Floor that there's the practical and there is the clinical side. What about the emotional side? And to me, that is a huge thing. And with the hospitals, they need to treat the practical. There's the end goal. But then as a person, we have that emotional battle. And I think that is actually something that we really need to group up together with on that side. So yeah. I appreciate anything that is in support of that.
It's something that's not really looked at as well. I mean, people kind of, like I say, it's the physicality of the treatment that people focus on, even the medical side of it. You know, the doctors, they're more concerned with getting you in the all clear or, you know, no evidence of disease, if you like. But the aftermath of it, they don't really deal with in that
That's
regard.
not their job, though, is it?
No, exactly.
But then we're still left, and they're doing their job, and they do it so well, and then but we're left like that.
And the problem is that the support structures aren't quite there as well, because like your clinical psychologists actually are quite long waiting lists as well. So you can't actually just go from your physical treatment straight into like a psychological treatment. It's quite a long process. So you know, you're not always guaranteed to be able to see someone straight away.
Okay, so with regards to that side of things, because we want to look at all the positives and explain the whole system of, I've got a whole load of questions here for you. Are there any support groups out there that you're aware of? I'm just throwing questions at you.
There's lots of support. Yeah, you know, there's plenty of support groups out there. There are local support groups that people can find. A lot of people do set up genetic cancer support groups. You get them through Macmillan, Maggie's. There's obviously you've got Joe's Cervical Trust, which is the main one in the UK. They've got support lines, a helpline. There's also the Eve Appeal, which is another probably less talked about charity, but it is there as well. There are numerous charities you can talk to. Obviously, you've got Cancer Research UK. Honestly, there's so many. I could, keep going all night with all these charities and trusts that are being made up. And there's even, trusts that have been made up through people who have lost their relatives, that, they've made their own little kind of charities and support groups up. And there's so many Facebook support groups as well. I mean, you can literally just type in cervical cancer support group and you'll have like a full list of cancer support groups or cervical cancer support groups coming up. So there is help out there.
I love those support groups as well, because actually they are the women and the men that are involved in this, because you have support groups of men, you have support groups of women, and actually I think it's the people supporting each other. It's just beautiful. So thank you for that, because we want to signpost people to where they can go to get some help. Okay, and then basically after you had your treatment and you were put back in your place, you then decided to gain fitness qualifications, because it was a love you'd always had.
Yeah, well, I mean, before I had done the the whole cancer thing, I got the cancer treatment and everything like that. I'd actually been planning to do my fitness instruction course, but unfortunately with the getting cancer, I just had to put a stop in it and wait. But by chance, I think it was nearly exactly a year after I was diagnosed, there was a little advert popped up on my local Facebook page through the council saying that they were looking for people to train as fitness instructors and go into the community and help. So I was like, well, this is perfect. It's a free course that the council are running. All I have to do is do a few sessions to pay it back. And, I'm up and running as a fitness instructor. So I thought, do you know what, why not? You only live once. So I jumped straight into the deep end and just got on and done it. And then I ended up actually becoming the Macmillan Moogmore instructor for the region. So basically any cancer referrals that come through the region for community fitness classes come through me and the council and the health improvement team in the area. And we basically direct people to classes that they can go to, events and activities that they can do that will help, obviously, not just their physical health, but their mental health as well after cancer, and help them, kind of come back into the community, because it can be quite a daunting process after being through, cancer treatments and then having to kind of integrate back into the community. You feel kind of like you're going to get judged, if you like, or people are going to pity you, and it's not a nice feeling. So to be able to kind of help people get back into it, then it's a really rewarding job.
Bloody brilliant. Bloody lovely. Love it. Okay. Now I've got a list of questions, but just if the internet did go a bit dodgy, then I'm going to ask you to keep talking about things that that people need to know. So what is cervical screening? Absolutely. Talk to me. What is cervical screening?
So the cervical screening it's not a test for cancer. It's basically just a method of preventing cervical cancer from forming in the cervix. So basically all they do is they take a swab, they use a speculum, which is a funny duck-billed shaped thing that they open up your vagina with, and then you use a really long swab, put it in, give it a quick sweep, and then they cut the end off, put it in a test tube and send it away for testing. And basically all it does is find out whether or not the cells that are on your cervix are either normal, abnormal, have got moderate changes or severe changes. So there's normally 3 or 4 different results that can come back. Obviously your normal is there's nothing wrong, you don't have to come for another smear test for another 3 years. Then you've got abnormal and moderate, which is, borderline, or they can be worded differently in different districts. So like different regions will be borderline, or some will be moderate or whatever. And that's kind of like they'll send you back again for a smear test in 6 months to see if it clears up, which normally it does. So, smear tests aren't normally all bad news. You do tend to get abnormal results quite routinely. It's not something that's uncommon. So then they'll send you back for another one in 6 months' time to see if you get the same result or a different result, which is what happened to me. And then severe changes, they probably send you straight for a colposcopy, which is basically a different type of more in-depth test.
Brilliant. Thank you, darling. And I'm going to keep asking questions because I've got so many here for you. I've got so many. No problem. So the benefits of cervical screening, well, that's helped to prevent.
Yeah, it's absolutely a preventative measure. If there's one thing, well, there's actually a couple of things you can do to help yourself or help prevent yourself getting cervical cancer, but this is one of the main things, because cervical screening can pick up changes when you don't have symptoms as well. So I didn't have any symptoms. I was very, very, very early staged when I got my cancer. I had absolutely no idea I had this rare cancer at all. And if those abnormal cells weren't picked up when they were, if it had been a year before or a year after, I could have been in a completely different place. So it's really important that for prevention's sake, that you do attend smear tests when you're asked to do so.
Yeah, brilliant. Okay, I'm going to come straight to the next one. What is this screening age range?
So it used to be, we used to in the UK do it from the age of 20, but that changed to several years ago because of the scientific evidence that basically showed that people around the 20 to 25 age range wasn't making much of a difference in the cancer numbers. It's a bit of a controversial subject, so a lot of people think that we should have smear tests earlier. I'm probably one of them as well, to be fair, but I'm not going down that route today. But our age range at the moment in the UK is from the age of 25 up to 65. And the reason for that is this is the normal age range where most cervical cancers will occur. Obviously, they can get them after 65 and you can get them under 25. That's not completely, impossible, but that's your kind of average age range.
Okay. So then I'm going to just throw in a question then. I know that some women find having a smear test very, very uncomfortable. They've got pelvic floor issues, so this is where the crossover of Adore Your Pelvic Floor is, that having a speculum inside is just like, and it's particularly painful. But there is things that you can do for that, isn't there? There is taking local estrogen for a few weeks prior to having a smear can ease that completely. Also seeing a women's health physio, she can help guide you through to be able to cope with that smear test. And also there was something else I was going to say, you can ask for a smaller speculum as well.
You can always ask for a small speculum. Yeah, totally. In fact, I've got a friend locally who actually does ask for a small speculum every time she goes. So, it's not a bad thing to do. You can also, if you're worried about, that type of thing, you can also get a local anaesthetic on the cervix as well if you're worried about the actual smear itself. I've had that when I've had the copper coil put in. So, it's not something that it's probably quite common for people to be asked for.
That's really important. Because we don't want women avoiding the smear test due to pain if there are answers and resources to help you cope with that, to resolve it, so that you can have it done, because there's bigger health issues, isn't there, that are involved. So again, if you've got any questions, put them in the comments on IGTV, or if you've got them, you can contact Adore Your Pelvic Floor. Yeah, you can contact us and we will get back to you. Okay, so the next question is, how often will I be invited for cervical screening?
So normally with this screening, you get invited, obviously at the age of 25, you'll get your first invitation. When you attend that smear and you've got your results and they're all good, hopefully, you'll then get a break of about, I think it's 3 years. So so it'll be every 3 years normally from the age of 25. Then from the age of, I think it's 50, I believe, 50, you get a 5-year callback. So If you get an abnormal smear and you maybe they're kind of more worried about maybe how it's going and they want to keep track of it, they might reduce the time from 3 years to 1 or 3 years to 6 months, depending on the type of changes that you had. But that's completely normal because the doctor just wants to kind of keep an eye on what's going on. I know that my first abnormal smear I had when I was, 22, because I was one of the ladies that first got it when she was 20. It didn't change till about 2 years after I got my first smear. So I got my first at 20, and then I was actually called back earlier than my 3 years because I had an abnormal smear. So it's just, these things happen, but chances are most of the time it will be normal.
Okay. So where will the screening appointments be held?
So screening appointments can be held at sexual health clinics. They can also be held at GP surgeries. Mostly the time it isn't a doctor that will take your smear unless you're maybe going for like a women's check or something with your doctor, and they might say, oh, if you had your smear, if you booked in, might as well do it now, kind of thing. Or you'll just book in and do your test with a senior nurse or a nurse clinician or whatever. Or like I say, at a sexual health centre, they might be a one local to you that you go there for your smears. It just depends on how your region actually works and how your cervical screening is done. But most of the time you'll find it's like a GP surgery and you just go to your nurse.
Brilliant, brilliant. So what is HPV?
HPV is the human papilloma virus. It's quite a common virus, and it's most people will be will come into contact with it at some point in their life. It's normally passed on through sex and masturbation and things. It doesn't say that you've not come into contact with it, because you can get the HPV on your hands and spread it with your hands as well. So it's always a good idea if you've got a daughter who's a teenager or a son who's a teenager, if they're able to get the HPV vaccine, then it's a really good idea to get the HPV vaccine, because they'll have that immunisation against HPV. HPV is something that can cause the cells in the cervix to change, and it also can cause certain mouth and throat cancers and anal and penile cancers as well. So it is a really important thing to know about and to educate yourself about, because it can cause all these extra problems. And
is it right they have this done generally at school? Oh, school age?
Yeah, normally it's normally about the first or second year in high school, I think it is. Normally before they technically become sexually active, they try and kind of get it around that kind of age, so early teens. But I mean, anyone can get the HPV vaccine. You can actually pay for it yourself if you really want to as well. But I mean, obviously, if you've already been in contact with the HPV, which probably a lot of people have, and they won't even know it, it's not going to make a massive difference, but it will give you some protection against it as well. So it's maybe worthwhile looking into it if you are worried about it.
And I take it that if you've had the HPV, you still get your smear test done, ladies?
Yeah, they actually do an HPV test, I think, during the smear as well, because they actually test for HPV. I'm sure there's a few areas in the UK that are actually changing it to test for HPV first and then go on to do like your normal smear test after, because it's a lot easier to test for HPV than it is for a smear test.
Okay.
Because it can be picked up, the virus can be picked up in the vaginal vault. So it's definitely changing. Like the roadmap for cervical screening is changing. There's lots of ideas floating around for home testing and things like that as well, which is really good. So anything to help people get the right testing done and the screening done in any way, I think is a good thing.
Yeah, definitely, because you can home test for other things, can't you? Chlamydia, etc. Excellent. So what my cervical screening test had, well, it shouldn't do, should it? And we did cover it earlier. It should not. Okay, so we don't get up and go, woohoo, I'm going to have my smear test done, but it is literally a minute or two, and it should not be it should not bring on discomfort
No.
or anything more than that. And that's where local estrogen or women's health physio or contact Louise or I and ask a question with regards to that. We'd be very happy to answer because we want to promote getting these smear tests done. You kind of covered what do results mean, haven't you, really? Or have we not? Earlier on.
Yeah. Yeah, so like I'll maybe just go over like the severe and moderate results. So depending on how if you have changes in the cells, can reflect whether or not you get further treatment, and they'll look into it further. So obviously, if you get like minor changes, chances are they'll probably just leave it the 6 months, and then that'll be it. You'll come back and get another smear, and chances are it'll clear up. But if it's a little bit different and there's moderate to severe changes, you'll probably then get sent for a colposcopy, which is obviously a little bit more in depth.
So what is a colposcopy?
So a colposcopy is basically similar to a smear test. So basically they still use a speculum. Most of the time your legs will probably be in stirrups though, because it's a little bit longer. So it's not as quick as a smear test. A smear test is literally just 2 minutes. You open your legs, you swab you, and you're gone. That's you done. With a colposcopy, it's a little bit more inconvenient, if you like. So you normally go into stirrups, they put your speculum in, and then they put some like dye onto the cervix so that they can see the outline of the cervix and any changes on top of it. So normally right away, they'll be able to see if there's any changes at all that they'd be concerned about. Now, speaking on behalf of myself, obviously my own experience with a colposcopy, I didn't have any really problems with it at all. They noticed the changes that were there. They weren't overly concerned about it when they seen them, hadn't obviously not knowing it was cancer. And what they do is they have a look in these like kind of, it's like a microscope type, binocular type thing. So it's just to have a really, really good look in to see the cervix really close up. They don't put anything in there apart from the speculum. So it's literally just, speculum goes in, they look at you through this like telescope type thing, and then they can see whether or not they need to remove the cells. And if they need to remove the cells, they can do it there and then. You don't have to come back and get it done, which is really, really convenient. So it means that you're not faffing around going to and from the hospital. So that's what happened with me. I got my cells removed. Like I say, she wasn't overly concerned about it at the time. Obviously, we didn't know at the time what it was. And she just said, right, okay, that's you done. We'll give you a call. We'll send you a letter in the next few weeks to let you know the results. That didn't happen, unfortunately. I got a call 2 weeks later, but yeah, but that's normally what happens. We just get a letter with your results to say what stage the abnormal cells were at, if there was any more concern about it, if you had to come back. But most of the time, it's just done and dusted.
Okay, so what are the symptoms of cervical cancer?
Okay, so you've got lots of different symptoms of cervical cancer. There are some that are more obvious than others, and a lot of these symptoms can maybe be what's the word? They can be assigned to other things you might have. So not necessarily all these symptoms will relate to cervical cancer. They might relate to other issues that you've got going, even period pains and things like that. So you just have to be really aware of your body, and anything that's like really not right for you and it's not happened before, just be really aware of it. So you've got unusual vaginal discharge. So that's like anything that is not right when you're between periods. If there's discharge that's discoloured, if it smells different, if there's a consistency change, anything that makes you think there's something not quite right there. I mean, obviously go through everything that you think it could be, like your thrush and everything, maybe see a doctor and, see what they say. It could just be a little yeast infection or something, but you know what? It's always worthwhile getting it checked. Then you've got between periods, you're bleeding between periods as well. So obviously any blood spotting between periods, you really should go to your doctor, because that's not normal, especially if you're pretty regular and you're regular. Always keep an eye on like when your periods are, and just anything that you're unsure of or you're concerned about, go see your doctor. Also, heavier periods as well can be a sign of cervical cancer, or bleeding for longer, maybe clumps as well. chances are, if you're having that type of bleeding, though, it would be quite later stage cervical cancer. So it's not as normal like in early stages. Discomfort while you're urinating. So if you're weeing and it doesn't feel right, if there feels like there's an obstruction there, potentially that could be an issue. Loss of bladder control, you'll know all about that when it comes to Adore Your Pelvic Floor. It's one of the main things, isn't it, that people say about the pelvic floor. So yeah, that loss of bladder control can be another thing. Pain during intercourse. So if you're having sex and it feels sore, it's not right, get it checked out. It's always better to get it checked out again. Fatigue, constant fatigue is another one. Pelvic pain, back pain, unexplained weight loss, and also leg pain as well. So any like kind of shooting pains and stuff like that down your leg can also be a sign that something's not quite right. So it's always best to kind of get those types of symptoms checked out if you've not had them before and they're persistent.
This is the trouble, isn't it? So many illnesses can have common feelings that we just kind of expect can happen. So yes, like you say, the time of the month, or many things can be put down to, oh, it's just the way it is. We need to just do that check with the GP, with the nurse practitioner, because your life is important. Okay. And it's not just cervical cancer. There's other many things that can be associated to this. This is the thing, is there's the cervical cancer, and there's other big problems that can also be associated with this. So, and then there can be the things that are like, no, that's fine. Get those questions answered. Don't just carry on. And then are all cervical cancer caused? Yeah, definitely. Are all cervical cancers caused by HPV?
No, it's not. Every single cervical cancer isn't caused by HPV. There are certain strains of HPV that cause certain types of cervical cancer, but there is evidence to show that not all cervical cancers are caused by HPV. The type of cancer I have is not linked directly to HPV. However, there is obviously in your body, you'll go through normal natural changes, and abnormal cells are normal in the body. It is normal to have your cells change. It's just when those changes get out of control that they start to spread, and then they clump together and it can form a tumour. So changes happen in the body all the time, and normally the body can flush those changes away and get rid of them, and all those little bits that aren't meant to be there normally get going away if you've got a really good healthy body and immune system. But just sometimes, cancers can be caused for any reason. It can be your lifestyle, it can be what you drink, what you eat, what you put in your body, what you put on your body. It could be chemicals and things like you've maybe got in contact with that have caused your body to react that way. Lots of different things can cause cancer, so it's HPV.
Okay, yeah, definitely. So this is the last question, and then if there's anything you want to add to it, please do. How can I reduce my risk of developing cervical cancer? Smear test for a start.
Yeah. Well, number one, go for your smear test. That is like the biggest thing that you can do to reduce your risk, because if it wasn't for that smear test I went to, I would not be sitting here today. There is absolutely no chance I'd be sitting here today. It's 3 years on in March from me getting diagnosed, and I can guarantee you that I would not be sitting here today if it wasn't for that smear test. Number two is, if you have a daughter or if you're a young girl and you can get the HPV vaccine, get the HPV vaccine, because it might not stop all cancers, but it stops a lot of them. So it's well worth getting that. Also, have a really good lifestyle. Try not to drink and smoke too much. Try to kind of be careful about what you're putting into your body, and making sure you're looking after your body as well. Keep active, because the more active you are, the better your body works. Make sure you're drinking lots of water. Just really, really look after and be as healthy as you possibly can. I know it can be tough, especially with people on budgets and things like that. It's a lot easier to buy cheap, crappy food, but the amount of processed stuff in food these days is horrific. And the cleaner you eat, the more your body will maintain that good working order. And it's just really, really important to look after your body. And I don't think I can think of anything else at the moment.
No, that's good. I think really, so if you've got questions, ask them, and speak to your GP.
Yeah, totally.
Yeah, and if you can't speak to your GP for whatever reason, then find where you can speak to, because you've got resources on Google, you've got resources in the Facebook groups, and Ask Us, and you got the Eva Pill, and you got the Joe's Trust, isn't it called? Is it Joe's Trust?
Yeah. So Joe's Trust, that's one of the Joe's Trust. The helpline number is 0808 802 8000, and you can obviously get the find them online at joestrust.org.uk. Joe's Trust do amazing like brochures and things like that to help about, you know, like the HPV vaccine and explain about it. So there's all this stuff that you can get from Joe's Trust, loads and loads and loads of information. You get little cards, like wallet cards that you can put in your wallet, you know, to, you know, really give you all the information. Is brilliant, honestly. If you are struggling with understanding anything about smear testing at all, get in touch with Joe's Trust to get them sent out. They even do like an easy read one as well, that's for like people with maybe literacy problems, you know, so it's really simple, and it's so easy to just phone them up, go online and ask for the extra information. Literally takes 2 minutes.
That is amazing. I really appreciate your time, Lou, because I know how busy you are. You've got your children and your family to look after, you're working, and then you got the likes of me saying, please, Louise, and you have. Louise has also written us a lovely blog. We published it on our website last year, and we've just reshared it again because it's worth resharing. So, yeah, check out Louise's blog on our website. It'll be on the media section. We've shared it on our Instagram and Facebook as well, and we'll be sharing this all over the place, Louise, because I want everybody to hear these good points that you've given us, because they're life-saving, and thank you.
Oh, no problem at all, anytime.
You're an absolute star. So we're going to say goodbye to you guys, and thank you very much for listening. And please, can you tell your friends and girlfriends, yeah, get your smear test done. Yeah, it's standard. Thank you. Bye-bye.